Hey everyone, Garrett DeRogers here, Doctor of Physical Therapy from Pro Results Physical Therapy in North County, San Diego, California. I'm here to talk to you guys today a little bit about a lumbar herniated disc. This is a very common diagnosis that we see that comes through the clinic. There are many patients that are presenting to their doctor's office saying that they have severe lower back pain that radiates down the back of their leg to their foot. This pain is very, very common amongst many community-dwelling adults. We see it all the time here in the clinic, but here's the good news. There are things that we can do to help you relieve the pain that's associated with having a herniated disc in your low back. Let's start out by just talking a little bit about what is a herniated disc. So when we say the word lumbar, lumbar is a term that describes the lower part of the spine, okay? If we look at the spine, the lumbar spine, from the front view, we have these little gelatinous discs that are between each spine bone. The purpose of those discs is to provide cushioning and shock absorption of the spine when we're doing various activities during the day. Now, what can happen is that when we repetitively do certain motions, most commonly lots of bending, lots of lifting, what can happen is that those discs can actually herniate, or they can essentially kind of get pushed backwards. When they get pushed backwards, there are nerves that come out between these little canals back here. These nerves go down your leg. So when that disc comes out and touches and irritates that nerve, we get pain that goes down the back of the leg. Okay? There are things that we can do to help out with the pain that's associated with a herniated disc. Now, let's have a look really quick. We're going to go through 3 exercises that we most commonly prescribe to patients that have lumbar herniated disc pain. Okay, the first one's called a prone press up. What we're going to do is that we're going to start by laying on our stomach just like this. Okay, now if you are in severe pain, we typically recommend these patients to start out by going on their elbows. Okay, from here, we're going to push up and we're going to arch our back. Okay, we're going to repeat that for 2 to 3 sets of 10 repetitions. Okay, the important thing is that we're getting the repetitions in. Okay, as this gets easy, we can progress the exercise to go on our hands, push all the way up, try to get to the end range, and go right back down for 2 to 3 sets of 10 repetitions. What we're doing is that as we arch our back, we're pushing that disc off of the nerve. So you should start to feel some relief of that leg pain as we get through some of the repetitions of the prone press up. Another great exercise that we're going to try is called a Camel stretch. How that's going to look is just like this. We're going to start out by going on our hands and knees, just like this. And from this position over here, what we're going to do is that we're going to push through our arms. We're going to arch our back, tuck our head forward, and then we're going to do the opposite. We're going to bring the head up, get a nice arch in that back, just like that, and repeat for 2 to 3 sets of 10 repetitions. What we're doing is that we are extending and we are flexing the spine, okay? Again, as we flex the spine, we're going to feel a stretch in the lower back and those muscles back there. As we then let the spine sink into extension and we bring our head up, that's going to extend our spine and should be taking pressure off of that irritated disc, okay, and that irritated nerve. So we should get less pain down the leg with that exercise as well. The last exercise that we give to many patients that have a lumbar herniated disc is going to be a piriformis stretch. The piriformis is a muscle that actually goes from the lower part of the spine and sacrum, and it actually attaches onto your hip. Many patients will say right in this area over here of the buttock, they get a lot of pain that builds up over there, and when that pain gets bad, we get shooting pain down the leg. Typically, that pain on that piriformis muscle over here is because the sciatic nerve, which is the nerve that runs from back here down the back of the leg, when that gets irritated, okay, because of an irritated disc and nerve in the back, that muscle gets very, very tight. So we're going to want to try to stretch that muscle. Easiest way to do that, we're going to lay on our back like this, okay? We're going to bring the leg up, just like this. We're going to grab that leg with both of our hands. We're going to pull it as far up as we can And then we're gonna pull across our body just like this. Okay, you're gonna feel a nice stretch right in this area over here. With this stretch, we're gonna hold that for 30 seconds. Okay, and we're gonna relax, switch to the other side. Same thing, pull up, pull across our body, hold for 30 seconds. We're gonna repeat that for 3 sets on each leg. Okay, after we do that stretch and we stand up, we shake it out a little bit, we should start to feel a lot less pain in that piriformis area. And when we get less pain and we get less tightness over here, we should get less pain down the leg. Try those 3 exercises. Obviously, consult with your physician or a physical therapist before doing these exercises. If the pain gets worse with any of these exercises, definitely let your physical therapist or your physician know, because there are some modifications that we can do to make these very tolerable and give you the relief that you need.